Ladies and gentlemen, good evening. Thank you very much for gathering for today's press conference. And given the circumstances, please allow us to speak while having masks on. My name is Kamoshida Naoki. I'm the Director for International Press Division of the Ministry of Foreign Affairs, and I today serve as a moderator for today's press conference. Today, as a briefer from the Ministry of Health, Labor and Welfare, we have Mr. SAHARA Yasuyuki, Senior Assistant Minister for Global Health, and Mr. Taguchi Kazuho, Director of the Office of the Global Health Corporation, Mr. KATO Takuma, Director, Measures on Novel Influenza Control Office. And from the Cabinet Secretariat next to me is Mr. HOSHIDA Junya, Councilor of the Office for COVID-19 Response at the Cabinet Secretariat. From the Immigration Services Agency, at the end of this table, we have Mr. UMEHARA Yoshihiro, Deputy Director of the Inspection Division. And next to him, we have Mr. Ozaki Sotaro. He's a councilor of the Embassy of Japan in South Africa, but currently assisting in the Consular Affairs Bureau in the Ministry of Foreign Affairs. We are using simultaneous translation, so please tune in channel 1 for Japanese and channel 2 for English. And today's press conference is given on the record. Today, our plan is to first, Mr. Sahara will brief you about the update of the situation in Japan. And I will ask then Mr. Hoshida from the Cabinet Secretariat to explain to you about the headquarters, which was newly established under the Special Measures Law, and the basic policies which was developed by this new headquarters. And then Mr. Ozaki from the Ministry of Foreign Affairs will explain about the update on the travel advisory for Japanese people. Then I will open the floor for questions. And when you ask a question, please raise your hands, and if you are picked up for a question, please walk down to the microphone nearest to you, and say your name and affiliation before asking a question. So now I'd like to invite Mr. Sahara to give an update on the situation of COVID-19 in Japan.
Thank you very much. Good afternoon, ladies and gentlemen. My name is Sahara with the Ministry of Health, Labor and Welfare. Thank you for your participation today. So from our ministry, we have already distributed materials. So based on that distributed material, let me provide you with the update. So updates on COVID-19 in Japan. Please turn over the first page. This is as of March 29th. Situation as of March 29th. So PCR tested positive cases, 1,866 cases in all. And on the right-hand side column, the number of deaths, 54. And those currently in hospital are 1,388. And the number who has already been discharged from hospital is 424. Next page, please. Next page. day by day, we have the confirmed cases. So the trends of the confirmed cases each day. For the past few days, in particular in the major urban centers, the number of cases, the PCR positive cases, I should say, have been on the increase, and we are greatly concerned about the situation. And page four, please. This shows the situation on a weekly basis up until now. So starting from, from the month of February through March, on a weekly basis, the number of cases have been increasing. And from March 23 through March 29th, you'll find that during this week, we have seen significant jump in the number of confirmed cases. So at the risk of repeating myself, we have to monitor the situation with great care going forward. Next page. This shows you the number of the distribution by age. And the red part relates to the number of deaths. So people in their 60s, we have seen one death in those in the 60s, but the rest are either in the 70s, 80s, or in their 90s, as far as the death is concerned. Page 6, please. This is cases in each of the 47 prefectures we have in Japan. As you see, from Hokkaido, Tokyo in particular, and Aichi Prefecture, and Osaka, and Hyogo Prefecture, these major urban centers, we have seen very large number of cases in these major urban centers. On the other hand, in prefectures where we have no cases, we have had no cases up until now, we're beginning to see cases even in those prefectures as well. Next page, please. That'll be page 7. This relates to several countries. And we show you the trend of the number of death cases in these several countries. So day 1 is the number of days since the occurrence of the first death case. As far as Japan is concerned, unlike the countries in Europe, for example, we have not yet noted a rapid spike in the number of deaths so far. But then, having said that, steadily, we anticipate that the number of deaths will be increasing in Japan as well. So it's important that we continue to undertake measures more than ever going forward. Next, page 8. Page 8 describes the 3 pillars of Japan's response to combat COVID-19 here in Japan. The overall goals are indicated as follows. First of all, we would like to the extent possible, suppress the transmission of infection to the extent possible. On the other hand, at the same time, it's important that we minimize any potential socio-economic damages. So it's important that we strike the appropriate balance between the two. That is required upon us, but at the same time, this is a very challenging task. In order to pursue this goal, we have these 3 pillars. The first pillar is early detection of and early response. For example, it's important that we respond to various regions are now taking measures to respond to clusters. It's important that we continue to reinforce efforts to respond to these clusters and issues. The second pillar. Having said all this, steadily, the number of cases and patients are on an upward trend. So therefore, inclusive of the intensive care system, it's important that we enhance the medical service system. And with regard to medical equipment such as ventilators and ECMO, it's important that we prepare these required medical equipments in a robust manner. And the third pillar is the behavior modification of citizens. We have been making requests to the Japanese public at large. For example, to the extent possible, restrain from going outside the home and also pursuing telework, remote work, and also staggered commuting. We are taking these measures to encourage behavior modification. Next page, please. If you could take a look at the following page. Please start with the left-hand side of the page. This is the result of the survey back in February, the red column. Well, sorry, let's start from the blue part. The blue part. These in an open environment, what will be the number of transmission by the first patient in the open environment? As you see in the box below, in the 80% of the cases for persons infected even in an open environment, they have not transmitted to others. But the red column, the enclosed environment, that's the red box. For several people, they've transmitted to 4 people, to 9 people, or to 12 people. So therefore, in closed environment, we have seen that the patients tend to transmit to a larger number of people. So as you see on the right-hand side, the so-called 3C, high-risk environments. In Japanese, we use a different wording, but in the English, we have coined this the 3C, high-risk environment. And we are asking the Japanese public to avoid these high-risk environments under 3C to the extent possible. And page 10. This is in relation to PCR testing. I think we have covered this page quite a number of times, so skip this page. Page 11. This relates to the capacity of PCR testing. And along the way, as you see, that we have been expanding the capacity. And on a daily basis, we are now able to accommodate 9,000 PCR tests on a daily basis. So the bar graph you see on the bottom, these are the number of actual tested cases. So please turn to the next page. What about the way forward? We have listed the 4 points of great concerns. And the first is that we're beginning to witness increased number of new cases in urban areas. And the second point of concern, we are beginning to see increased cases with unidentified source and also cases where we're not able to unravel the link between the cases. Also, the third point, not just here in Japan, but outside Japan, we are seeing increased the number of deaths. And accordingly, number 4, we're beginning to see many imported cases here to Japan. So there's an increasing number of imported cases to Japan. So therefore, under the circumstances, it's important that we continue to take robust measures going forward.
And in order to do these, we need to have a thorough infectious disease control measures implemented. At the same time, have a well balance with the damages that it may cause to the society. And then another important point is on the second bullet point, need to prevent overwhelming hospitals. And also the last point, we need to have a full collaboration with the local governments and to control the situation, being considerate to the local situations. As I have shown in the slides before, depending on the prefecture, the situation that they face differs. So it's not going to be just a one pattern type of response. But we need to have a flexible response that will be matching each local situation. And we also would like to listen to the local government's opinions and have a close collaboration with each prefecture's local government. And by comprehensively taking such actions, as you can see at the very bottom, we'll be able to, as much as possible, delay and lower the peak of infection. And that is what we're aiming for. And the last slide is showing the concept that is behind these measures. And currently, we are pulling our full efforts into this. That is all from my side.
Sorry, at first I failed to introduce one of the important briefers, Mr. FURUSE Yuki. He's an expert working with the Ministry of Health. Mr. FURUSE is an assistant professor at the Institute for Frontier Life and Medical Sciences, Hakubi Center for Advanced Research at the Kyoto University. I'm sorry for that. Then I would like to move on to ask Mr. Hoshida to explain about the headquarters and its basic policies.
ありがとうございます。それでは
Thank you very much. From my side, I would like to share with you the basic policies. But before I go into that, I would like to explain about the task force. The other day, Act on Special Measures Against Pandemic Influenza was amended, and the novel coronavirus became under this act. And this is something I have explained before. And based on this special act, March 26th, the government task force or the response headquarters was established. Up till now, there was the novel coronavirus response headquarters where all of the ministers attend. We had that headquarters, but on March 26th, we have established the task force based on the Act on Special Measures. And the government's task force based on the Act on Special Measures was established. Therefore, in all of the prefectures, they have also established their local task forces. After the establishment of the task force, March 28th, at the government-established task force, the basic policies were set. And in front of you, we have distributed the outline of the content. Here, there are 3 pillars. The first is the facts on current situation of the novel coronavirus infectious disease. And the second pillar is the overall policies. And the third will be the key points. And these pillars are in a box on the paper in front of you. Based on the law and act, these are set under the basic policies. First of all, regarding the first pillar, facts on current situation of the novel coronavirus infectious disease, the fact regarding the current situation is written there. Nationwide in Japan, there is a possibility that the situation may lead to explosive spread of infection and become a pandemic. And the second point, the overall policies. Over here, we state, moving forward, what are we going to do? As the government of Japan, or as Japan, which direction should we head towards, is stated here. And this is overlapping of what Ministry of Health, Labor and Welfare has explained. But first is to slow down the speed of the infection and minimize the incidence of severe cases and death through thorough measures, and minimize the impact of society and economy through pandemic prevention and economic and employment measures. And pillar number 3, under the key points, a more specific policies are stated. Over here, there's nothing that is stated that is totally new. Basically, what is stated here is overlapping what the government and the prefectures have been conducting up to this point. However, we are showing it as a basic policy under the government established a task force. And as the government and also the local governments, based on these policies, things will move forward, is now shown to all the people in Japan. And till now, the individual prefectures have been making requests to their people for to refrain from going outside or holding large-scale events. And regarding these requests, each prefecture has been keeping an eye on the local situation, and actually that action now is clearly stated in this policy. And based on these policies, the actions will be taken under the clearly stated policies that you see in front of you. And there are 6 items under the pillar number 3. You please take a look at the individual details later on, but the first is the provision and sharing of information. What this means is that towards the people in Japan and including the foreign nationals, we will provide accurate information, is what is stated under provision and sharing on information. And number 2 is regarding the information gathering. Information of the infected patients. We will thoroughly gather that information and have a full grasp on the situation, is what is stated here. And the third is pandemic prevention. As I have stated already, each prefecture, keeping a close eye on their local situation, they will come out with measures and policies in an appropriate way. And if a prefecture has a possibility that a cluster is occurring, if there's a possibility that a cluster may be occurring, they will make a request of a self-restraint or avoid gatherings in a large scale or holding events. And between the local governments, they will have a close information exchange, is also what is stated here. The fourth, regarding medical care, here it states that we will establish a thorough medical provision system, and depending on the local situation, it will be dealt in a flexible manner. And number 5 is economic and employment measures. This is written in a very concise manner, very short. But what this is saying is that on a necessary basis, this will be implemented, meaning that not just under this basic policies, but under other measures, this economic and employment measures will be implemented, is what we're saying. And the item number 6 is other important notes. And towards the patients or the medical staff who have diagnosed the infected patients, we will have to protect their human rights, and masks or disinfectants type of supplies need to be appropriate provided, is what is written here.
And also, item number 3. Closely, we will work closely with government. So therefore, inclusive of local governments and other relevant agencies, there will be sufficient coordination. That is also prescribed in this basic policy. And last but not least, with regard to the decisions on whether or not declaration of emergency will be made, will be issued will be based on comprehensive assessment, taking into account the situation outside Japan and also taking into account the opinions of the advisory committee. So that is the establishment of the government task force and also the substance of the basic policies. That is all from my side. Thank you very much.
Now I'd like to invite Mr. Ozaki from the Consular Affairs Bureau of the Ministry of Foreign Affairs to briefly explain about the revised travel advisory which our ministry announced today.
外務省領事局で
Thank you very much. My name is Ozaki. I'm with the Consular Affairs Bureau. Thank you very much. As was mentioned just now, today, Minister Motegi announced the upgrading of the warning on infectious disease level. I will not introduce everything. I will not introduce rather all the comments made by the minister during the press conference, but let me just share with you some of the information available at this juncture. So with regard to the novel coronavirus infection, the number of cases and the death pertaining to the novel coronavirus has been increasing very rapidly on a global basis, and WHO has characterized the situation as a pandemic. And subsequently, we have seen the spread of cases throughout the world. And as of today, in 176 different countries and regions, more than 740,000 cases have been seen. And the pace of infection has also been accelerating. And furthermore, in Japan, for the past 10 days, we have seen those who were affected, who were suspected cases were people who were infected abroad and importing this case. That number has been 10 per day for the past 10 days. And also, the Japanese nationals abroad are now faced with mobility restrictions such as sealing off of the border and also restrictions on and also orders not to leave the house. So, taking into the situation in a comprehensive manner, the Minister of Foreign Affairs has decided to undertake two measures. First is with regard to the number of 10,000 infected cases and also the imported cases from outside Japan, taking that into consideration. In relation to 49 countries and regions, they have decided to upgrade the warning on infectious disease level from level 2 to level 3. That is to recommendation to suspend travel. So inclusive of the countries that have been level 3 already, 73 countries will now be subject to level 3. And the second measure, aside from these 73 countries, countries outside these 73 countries. Let me rephrase this. Aside from for countries outside these 73 countries and regions, the level has been increased to level 2, which is avoid all non-essential travel. So countries other than 73 countries will not be subject to level 3, level 2 rather. So bearing in mind going forward, bearing in mind the prevalent circumstances, the full measures will be undertaken. We will continue to review the travel advisory as well as the warning on infectious disease level as required, and also we'll continue to take border control measures in coordination with other agencies. And also third, we will continue to provide information through website at the MOFA and through various mails in a timely manner. And fourth, through embassies outside Japan. With regard to Japanese nationals and Japanese travelers, sufficient assistance will be provided so that we can secure safety of the Japanese nationals outside Japan. That is all from my side. Thank you very much.
Thank you, Mr. Ozaki. So now I'd like to take questions from the floor. And if you have questions, please raise your hand and use the microphone and say your name and affiliation before asking a question. Mr. Paribu.
My microphone is not on. The microphone is not on.
Is that all right? Yeah. Richard Lloyd Parry of The Times. Mr. Hoshida, at the end of his document, it says that decisions on the declaration of emergency will be made taking into account the opinions of the advisory committee. But one of the members of the advisory committee, Mr. Satoshi Kamayachi of the Japan Medical Association, is quoted today saying that I personally feel it's time Japan makes the declaration. And he said that almost everyone agreed that it's better to declare a state of emergency. He's talking about other members of the expert panel. So if that's the case, why is the government not following the advice of experts and declaring a state of emergency? And what are the criteria? What exactly are the criteria for making that declaration? Thanks.
Thank you very much for your question. First of all, on March 28th, the basic policies for the novel coronavirus disease control was determined. And at the same time, we have received the views of the expert panel and the advisory committee on March 28th. And the advisory committee did not provide a conclusion whereby the current situation would warrant a declaration of emergency. That was the opinion of the advisory committee on that day. Now, Dr. Kamayachi, he is indeed a member of the advisory committee. That is a fact. But was his view the majority of the view of the members of the advisory committee? So the government is not able to confirm whether or not this is the view of the majority of the members of the advisory committee. So as of March 28th, on March 28th, they did not make a decision that the current situation would warrant a declaration of emergency. And, if I may. Now, what about the specific criteria? Criteria is set forth under the law. The first criteria would be the symptoms are severe than the symptoms of a ordinary influenza. And this, again, I think we need to receive the views of the experts. In the case of the COVID-19, there's a high probability that this would satisfy that first criteria. Now, with regard to the second criteria, the transmission routes cannot be confirmed, and also the patients that are behaving in a manner whereby there is a risk of spread on a very broad basis. That is the second criteria. As far as this, and also before that, under law, based on rapid infection spread nationwide, significant impact, there's a risk that significant impact could be provided on the Japanese public. That will be the criteria based on which a decision will be made. So, do we have a situation that is likely to have serious? Do we have a situation where there could be serious effect to the lives and the health of the public? I think that is not yet the case. In any event, as of March 28th, the Prime Minister, in his press conference, stated that we are, of course, at the threshold of the situation whereby the declaration of emergency will have to be issued. Right now, we are on the brink, and that situation has not yet changed. So going forward, we will continue to receive the views of the experts and make our decision. Thank you.
I take your point about the advice that was given on the 28th of March by the experts. However, that was 3 days ago, and as you know, the situation is developing very quickly. Is it not possible that since the 28th of March, the views of the experts has changed, and are you not consulting them more often on a daily basis?
Thank you for your question. As far as, well, yes, it is true that the advisory committee met back on March 20th, and that was the last meeting. Now, as far as the views of the experts are concerned, although we do receive views of the experts on a daily basis, although not from all the members of the advisory committee on a daily basis. Now, whether or not this will take the form of the advisory committee, but as far as the experts are concerned, it is likely that there will be a meeting among the experts very soon, within this week. So at the experts meeting, we would like to solicit the views of the experts at that juncture.
Ms. Reynolds.
Isabel Reynolds from Bloomberg News. Just another question about the emergency declaration. As I'm sure you know, there have been a lot of social media rumors that the declaration will happen tomorrow and the emergency situation will start the next day, which a lot of government ministers, including, I think, Mr. Abe, have denied. But to clarify that, is there a system of steps that have to be taken before the declaration is made? For example, I've heard that Parliament must be consulted about the declaration. Could you give me a step-by-step list of how we would get there?
Thank you very much for your question. As the stages or the steps that we need to go through, this is not stipulated in the law, but the government action plan that is decided by the ministers, we will hear the opinion of the expert advisory committee and declare the state of emergency. So, first, the basic policy, the advisory committee, we will hear their opinion. So we will have to hold the advisory committee first. And in relationship with the diet of Japan, strictly speaking, once the declaration of state of emergency is done, we will talk to them. That's stipulated under law. But within the amendment of the Special Act, there's a supplementary decision-making process, meaning that once something passes through the diet, the supplementary provisions there, it says that we need to notify the diet beforehand. No, if I may rephrase, unless there's a really true emergency situation, we will notify the diet beforehand as much as possible. And we would like to respect that as much as possible is what we are thinking. I'd like to ask a question of the spread of infection. The current situation in Japan, I believe that about is similar to what France has experienced 3 weeks ago, meaning that the confirmed number of infected patients, 2,000, and the death was about 50. The current France situation, the confirmed patient is 45,000, and death is 3,000. It has increased to that point. So the increase or expansion of the transmission or infection, do you think a similar situation may happen in Japan? My name is Nishimura from Lacu, France. Radio France. What is going to happen to Japan? Of course, we are feeling the sense of crisis. The numbers that we face right now, how is that going to change? It's very hard to predict. but in Japanese we call it overshoot, which is the explosive infection spread. We have to avoid that, and we're putting our full efforts to avoid such a situation. And we do understand the serious situation that the European countries are facing. So in order to avoid such a situation in Japan, we would like to take thorough measures and implement them. And areas that we can strengthen, we would like to strengthen. I cannot directly answer your question. However, we do not know what's going to happen. But we should not relax at all and continue what we are doing right now. So, in case Japan faces the same situation as France, is the medical system set up to respond to it? In France, the ICU, currently, there's about 5,000 patients in ICU. The medical service providing situation here in Japan, currently there is infectious disease designated institutions, meaning that prefectures designate medical institutions as in taking care of infectious diseases. About 25,000 beds are secured at this point. And I believe it was yesterday, Tokyo said that they will secure 4,000 beds in overall Tokyo metropolitan government area. So in terms of the number of beds, we will like to utilize those beds. But either way, if there's an explosive expansion of infections or transmissions, there will be a burden put on the medical dedicated staffs, and we will need medical supplies. Therefore, the number one important thing is to avoid an explosive spread. That is why we are implementing measures such as responding measures to clusters and others. The number of ICUs, like medical equipment such as ECMO, equipment that will be used in ICUs. Currently, the number of units of ECMO we are still confirming, but regarding the respirators, it's about we are secure 3,000 units. The number of units for ECMO, about 400 to 500 are secured is what we have heard. We don't have an accurate, precise number yet.
Gentleman there, please. I'm Thomas Hahn from Süddeutsche Zeitung. When I see the chart here, then I see indeed an explosive increase for March 25, 27, 29. But I see actually also an explosive decrease in March 30. So what is the explanation for that? Or is there an explanation for that? Or is that a sign of relief? Or what's the explanation for that?
The reason for the situation is that there was the weekend, Saturday and Sunday in between. Therefore, the medical institutions were days off. So there are cases that the cases were not tested, is our understanding. Every week we see the same trend, actually. And if I may add, the announcement of the number of infected patients, the reason why there's an increase in the last week is because the Tokyo Metropolitan Government or Chiba Prefecture, they have identified or detected a cluster, and the close contact people with the clusters are intensively tested, and that is why the numbers we were able to, we saw the increase in numbers. So once the cluster situations are calmed down, there is a possibility that in terms of the number of patients will go down. But of course, if there's a further increased number of clusters, the number of patients will further increase too. That is my answer.
Ms. Reynolds again.
Isabel Reynolds again from Bloomberg. I have seen at least one report that ICU beds in Tokyo are getting pretty full. Is that your perception of the situation? Is one thing. And I have one other question, which is about future policy. I've seen a report that in Germany they are considering a program of blood tests to find people who already have immunity to the virus, which would enable those people to go back to normal life. Is that something you're considering? How possible do you think that would be?
Thank you. As far as the number of ICUs in Tokyo is concerned, as far as the Ministry of Health, Labor and Welfare is concerned, we do not have those numbers. But at the TMG, Tokyo Metropolitan Government, I know that they're making efforts to coordinate the number of ICU-related beds. So with regard to ICUs in the designated medical institutions for infectious diseases, I understand that the number of patients are on the increase. But in the case of TMG, there are medical institutions outside the designated medical institutions for infectious disease. So TMG is now making coordination so the hospitals that are not designated medical institutions for infectious disease could accommodate these patients. So we would like to render our support for those efforts. Now, with regard to antibodies, with regard to the tests in relation to antibodies, in Japan, we are considering a plan for antibodies. We have nothing that we can share with you at this juncture. There's no at this juncture, but this is being considered. But then there are several issues as well. The major issue on hand is that the antibody, when you test for the antibody, what are the tests? What are the methods? There is no established method for testing the antibodies on a global basis. So we need to coordinate and collaborate with the international community to come up with methods in which the test could be done for the antibodies. Thank you.
The lady at the back.
Hi, Fred Dvorak from the Wall Street Journal. I have a question about the confirmed cases, the number of confirmed cases. In every country, there is a gap between what you imagine the actual number of cases is and the reported number of confirmed cases. What do you estimate the number of undetected cases is in Japan? And as a second part to that, if you think that if the number of actual cases is close to the number of confirmed cases, how do you explain the relatively high mortality rate that you get from the current reported numbers?
Yes, with regard to the gap, I think there's a gap in terms of these numbers in all countries, I would imagine. So, in terms of predicting actual number of patients, I think it's very difficult to gauge the actual number of patients. our testing system per se, when the doctors suspect that this is a case, this is a potential case, then we have a system whereby these doctors could seek testing. But then, so how many unconfirmed cases are there? It's very difficult to try to follow undetected cases against that circumstance. But we've asked various doctors that if they have a method to come up with the undetected cases, that they should share that information with us, and we are consulting with various doctors on that point. But then I think it's very difficult to interpret the prevailing circumstances. Now, as far as the percentage of mortality is concerned, I think it's not that the mortality rate in Japan is unusually high. I do not think that is the case. So the positive cases, I believe, right now is 1,056 deaths out of 1,887 confirmed cases. So that being the case, the death rate is 3%. So compared against other countries, I don't think that represents an overwhelmingly high number. But having said that, the mortality rate to the death rate, we have to be very careful when you calculate the mortality rate. For example, you have when the death rate increases as more days pass since the patient is confirmed. The positive. Let's say that you have 100. Let's say that you identify 100 patients. The first day, the mortality rate is 0, but then after 10 days. If you take a look at the 100 patients, you still have 1 death. And then after 20 days, then the death, you could have 3 or 4 people dying. So on the 20th, on day 20, the mortality rate is 20%. But then on day 10, it's only 1%. So depending on, although you could take a look at the same group, depending on the day you take a look at the mortality rate will naturally vary. But it's a cumulative number, right? More death rate and the infected cases, it's cumulative, right? In case of Japan, we have seen cases from an early phase. So already we have seen cases from January. And this is a cumulative number from January as far as Japan is concerned. As for other countries, when you have rapid detection of cases in other countries against the number of patients, the monitoring period is much shorter, so the mortality rate could be lower. And also, I think you have to confirm the age distribution. For example, if the more elderly the person, the mortality rate becomes higher. So you have to take that factor into consideration as well. So it's very difficult to compare an apple to apple in terms of mortality rate between different countries. Well, I know that there are different views of various experts. So is 3% is high or not? That's true. That there are a lot of numbers being floated about. So is 3% high or not? But if you don't want to overwhelm the medical institution, in countries with good medical institutions and where hospitals are not yet overwhelmed, the mortality rate is only about 1%. So that against that context, I was wondering how you would interpret this mortality rate in Japan. Well, as you pointed out, if all the patients are we able to identify all the patients through PCR testing, I think no country is able to have 100% coverage through PCR testing. But for whom should you carry a PCR testing? I think that policy for PCR testing is very critical. So are you going to provide PCR testing to all people who want them, or are we simply going to provide PCR testing for those cases who our doctors deem that it would be necessary, bearing in mind the pre-existing medical condition of that particular patient? So I think that policy decision will come into play. As far as Japan is concerned, when doctors deem that it is required, then for that particular patient, anyone will be able to receive the PCR testing. And also, at that juncture, public health insurance will be applied, so the testing can be done at no cost for the patient in question. So we would like to make sure that we have a situation whereby testing can be done for those who need them. Where we stand today, we do not yet see a situation where the hospitals are totally overwhelmed. We are not yet at that stage. So we believe that this current mechanism is working appropriately at this moment.
Mr. Parry.
Thank you, Richard Lloyd Parry of the Times again. I have a question then about testing. As you know, the head of the WHO has urged countries to test, and has praised governments like that of South Korea, who have made the decision to test anyone who wants a test. Japan has chosen a very different policy. Your testing rate is far, far below your capacity. So explain to me then why the WHO's clear recommendation is wrong for Japan, and what would be the negatives of doing what the WHO says you should do. And the second question, just a small question. We have this figure of the total number of tested cases, 52,000. As I understand it, that's a total number of tests carried out. It's not the total number of individuals who've been tested, because some people are tested more than once. Could you tell us the number of individuals who've been tested, if I've got that right?
The number of tested cases, or number of people who have been tested, exactly 30,000. 30,080. 8 people have been tested. 32,497 people have been tested. And the head of WHO saying test, test, test. Yes, he did say that. But regarding this, WHO is not saying to test people who have just a concern. And that is actually clearly stated on the website of WHO. But for the people who may have or suspicion of having the disease, they need to be tested, is what they're saying. So the policy of Japan and the policy of WHO, in that sense, we don't think there's any difference.
Rocky Swift from Reuters. Just as a follow-up to that, Dr. Sahara, you've suggested in this room in weeks past that the numbers of Japan's testing cases were low because that represented the judgment of the doctors, whether they decided to order tests or not. And in the past week, we've seen, or maybe more than a week ago, one of the directors of the Japan Medical Association gave evidence that there was some 290 some cases nationwide where doctors requested tests, and yet they were denied by the central health body. So that sort of goes against what you said, that this is all up to doctors' discretion whether to test or not. And how do you respond to this?
So the Japan Medical Doctors Associations, regarding the cases that the requests for tests have been denied, it has been surveyed. And regarding those cases, We did receive part of the information regarding that. And regarding part of that information, we are inquiring the local government, and we have confirmed what the situation was. But the public health center did not handle things appropriately, meaning that even though the doctor was requesting for the test, and the patient was not able to receive a test at the end, within the cases that we have confirmed, we did not find such cases. But the Japan Doctors Association's result of their study, well, they are saying that we are going to once again look into it for accurate information that they took over. So we don't know about that situation at this point yet.
Other questions? Month back, please.
Thank you very much. I'd like to ask in Japanese. I'm from the Japanese media. Nikkei Asian Review, Obe is my name. Several questions. Starting from a very basic point. First of all, the Special Measures Act. With the Special Measures Act, you're now able to reflect this in document. So you're going to take responses based on on what is provided for under the Special Measures Act. So I know that that represents a change for the previous situation, but still it is based on request. It's request-based situation. So what's the difference after this new change? What changes after this new Special Measures Act? It's not going to accompany any binding force. So can you really change the situation even under the Special Measures Act? That's my first question. And my second question, with regard to a lockdown type of a situation, and in TV, in television, they're reporting about small restaurants and small operators not fully prepared to accommodate the lockdown situation, so they want to avoid that situation. So how prepared is Japan to accommodate a potential lockdown situation? Are you not going to issue this declaration until Japan is fully prepared? And the next question is about the Eiju Hospital, the cluster. And the number of people involved in the cluster is now close to 100 in this particular hospital. So as of today, why do you believe that this situation is occurring? This is the largest hospital in that given ward. So I'm surprised that such a situation should take place in this major hospital in this particular city. Is this a special case, do you believe, or is this applicable to other hospitals? Any lessons we can draw? If this is the situation, other hospitals will not want to accommodate infected patients. So how do you intend to respond to the situation? Thank you. Thank you for your question. First, so the basic policy has been provided. So what has changed under the new basic policy? Let me respond to your question. What has changed under the new basic policies? As you pointed out, for example, in terms of restraint from leaving home, or in terms of restraint on holding large-scale events, the head of municipalities and prefectures can only make a request. As we already explained in the previous conference, in the event that the emergency has been declared, we can only request that people refrain from leaving house to individuals. That remains unchanged. With regard to restraint for large-scale events, we will make a request that they refrain from that. And if they do not comply, we can provide instructions. So this is only after the declaration of emergency is issued. So in the subject area for declaration of emergency, such measures will now become possible. Now, in the case of instructions, there is no penalty involved. We can only provide instructions, but no penalty will be involved. But it's from the legal perspective, if an instruction is issued, then this involves legal obligation, although there is no penalty involved. That is the structure. So, what type of legal obligation should be involved, and what penalty should be involved? This relates to personal freedom and also the sovereignty of the public. So we have to strike a very delicate balance. So trying to force something based on penalty here in Japan might be somewhat challenging. So that being the case, going back to your question, if I were to respond to your question, based on the basic policies, and based on uniform policy of the Japanese national government, we are now able to issue requests. So it's a very ambiguous expression, I understand. But I believe this represents I believe we're able to provide a request based on much clearer ground compared to the past. So I think that is the significance of the basic policies announced on March 20th. So that's the first response. Second question, is Japan prepared for the potential lockdown? Frequently, people ask what will happen when lockdown is issued. For example, based on this Special Measures Act, it will be challenging to issue lockdown based on the Special Measures Act. So I think it might be possible if we have a legal interpretation on a stretch for existing law. For example, a penalty if people leave house. But there is no such a law in Japan. So that type of lockdown is going to be difficult based on common sense. But going forward, there might be room for maneuver. But I think anything based on Act on Special Measures law, Act on Special Measures, simply will not be viable. Now, is Japan prepared? So with regard to a declaration of a state of emergency, is Japan prepared? In the case of small-scale restaurants and so forth, are we awaiting the declaration of emergency just because the small-scale restaurants are not prepared? That is not the case. But you have to take into consideration the prevailing level of infection, and then a decision will be made by the government. And at that juncture, decision will be based having taken into consideration the advice of the experts. So my response is in relation to declaration of emergency. So that is our principle in relation to the declaration of emergency. Thank you.
If I may add, you talked about the Asia hospital situation. This is the same in Italy. First of all, inside a hospital, the infection spreads. That is quite of a crisis situation, is what we think. This Asia hospital, why did it face such a situation? The Tokyo Metropolitan Government is examining it or investigating it right now. So at this point, we're not at a stage to say or explain something about this. But a hospital is a place where various type of people come. And the hospital has the obligation of seeing a patient and making a diagnosis. So a similar situation occurring in another hospital, the possibility of that, we believe that there is quite of a high possibility. And that is a crisis situation. And that is where each hospital is being very careful to avoid such a situation. So the standard prevention measures, wearing a mask, or each patient washing their hands, disinfecting with alcohol, and those type of preventive measures are extremely important. And we believe that it's important that such infection does not spread inside a hospital. And also, what was asked previously, the death rate numerical relationship, I think the expert to explain that. In Japan, that many are not tested, the mortality rate is high, so maybe there are hidden more number of patients was a question, so I would like to explain that. And this explanation is not as a government of Japan, but as an expert. I'm just sharing with you the possibility that I can think of. First of all, a country that is not Japan, let's say that they're able to test all of the cases. And that's impossible in reality, but let's say they are. And let's say there's 10,000 patients, and out of that 100 deaths, and then the death rate is, or mortality rate is 1%. And there's a 10,000 and 100 people are dead, so there's 1% of mortality rate. Let's say in Japan, it's less than that. There's about 1,000 patients, and the Japanese mortality rate is better than other countries. I don't know. This is just hypothetically speaking. Let's say that Japan's mortality rate is lower than the other country. And out of 1,000, let's say 5 deaths. Then the mortality rate is 0.5%. So it is lower than the 1.0%. And in Japan, all of the patients are not tested, and we're able to detect only 50%. And at that time, it's a 50% of 1,000. That means that the patients detected is 500. And out of the 5 deaths, and 2.5 people, which is half of that, when the doctor is strongly suspicious, they will be able to be tested, or the doctor thinks that this is not a death from a regular pneumonia, but a different type of a pneumonia, and so all 5 people will be tested. So Japan narrowing down the number of tested patients. Out of 1,000, only 500 were tested positive, but the people who died were 5. The doctors had strong suspicions, so they got tested. But because we narrowed down the tests, then the other country becomes 1% and a higher percentage. And that is the mechanics behind why some countries have a higher death rate than others. This is just hypothetically speaking. It's not that because of the death rate is high, that does not directly mean that there are more number of people, of patients that are infected behind those numbers.
Mr. Parry.
Richard Lloyd Parry of the Times again. Regarding Mr. Hoshida's last answer, am I right in understanding that under Japanese law, even if the emergency declaration is invoked, you cannot force people legally into staying in their homes with penalties? All you can do is strongly ask them. Is that correct?
Based on the Act on Special Measures, we only can make a request to the people.
As it presently is, a lockdown of the kind that is being enforced, for example, in European countries, where people are fined if they go out, they have to carry documents saying what they're doing. That's impossible. Am I correct?
Under the Act on Special Measures, or based on the Act on Special Measures, we cannot enforce such thing that you have mentioned. I'm repeating myself, but only thing we can do is make a request. So the lockdown that we see in European countries, well, sometimes in Japan, the possibility of lockdown is reported through the media, but legally, how that can be done, I think it's going to be very difficult, meaning that we may have to have a difficult interpretation or a stretch interpretation of the law and try to implement such a thing, saying that it is a true emergency situation. Maybe such thing may happen. However, this is a rule-based, a law rule-based country. So in the current Japan, such a thing will be difficult. I'll be repeating myself, but based on the Act on Special Measures, that cannot be done. It's impossible.
question, is there anything that can be enforced under the emergency law? For example, I believe that one of its provisions is that it allows the Prime Minister or the government to requisition properties, buildings, hospitals that are needed to fight against the infection. Now, can you forcibly requisition a building with penalties, or does that also ultimately depend on the cooperation of the property owner?
In relation to the Special Measures Act, there are some provisions that company force, that can be forced. But I think even having said that, we start with the request and then go on to instruction. So there are such provisions. For example, I don't have the exact wording, so please bear with me. But let's say in the case of emergency supplies, ultimately, the prefectural governors can requisition and can procure those emergency supplies after having gone through the request phase. They can actually forcibly procure goods, emergency supplies from operators. And also, in the case of, well, let me go back. Let me see. Temporary medical institutions. If there's a shortage of medical institutions, so setting up temporary medical institutions, when you want to create such institutions, there are some provisions that relate to the land based on which the temporary medical institutions would be built. Now, with regard to the requisition of emergency supplies, for example, there's a penalty if the person or the operator hides those supplies from the authorities. So in the case of very dubious cases, then there are some penalties. But penalties apply, provisions that relate to penalty are quite few in number in this act. So I don't have the provision on hand. Please bear with me. Thank you.
Mr. Swift, please.
Rocky Swift from Reuters again. I'd like to return to these three pillars that you discussed as your strategy to rein in the contagion, and number 3, behavior modification of citizens. So today, the Line chat app released a survey that was done in coordination with the health ministry. And it showed, for example, that only about less than 9% of the respondents said they could telework. If I'm reading it correctly, 30% said they were not, that they were obeying your recommendation of not talking in large groups. And about 50% were obeying your recommendation on not being in cramped places with bad ventilation. So would you say that those results are a validation that you are changing behaviors successfully? And if not, this one of your pillars may not stand, and the table with just 2 legs can't stand. So what is your response to that?
Apologies, we have not yet seen the result of the survey that you referred to. So, but we are aware that there are a lot of views. So with regard to change in behavior and behavior modification of citizens, I believe that to a certain degree, we have seen behavior change and behavior modification among the citizens. So clearly, for example, the congestion on trains have been reduced, and also compared to the past, people are increasingly large number of people are working from home. And also when it comes to shops, very large number of shops closed. And also, and I think dinners, the number of dinners have been reduced. So I think we're seeing behavior modification. But is this perfect? Is this complete? I think there's still room for improvement, significant room for improvement. We are aware of that. So that is why Prime Minister Abe and also the Governor of Tokyo Metropolitan Government has repeatedly put forward their request with regard to the 3 Cs. Please avoid the 3 Cs. That is why they're repeatedly putting forward that request.
Agent reviews, Obe. Regarding online medical service, in order to avoid a further spread of infection, being able to remotely diagnose a patient, I think moving forward, it is an important method. But you cannot use it for the first doctor's visit, or the unit price is low. Due to these reasons and others, this is not penetrating as much as expected. So the basic way of thinking, this online diagnosis or online medical consultation, is this just going to be something on the side, or is this going to be something, a main measures that you can implement, or your intentions to increase it? Can you share with us your views? Today, the representative that's in charge of the online medical consultation is not here, so I cannot give you the most accurate answer. But the first visit, all of the first visits dealt with the online medical consultation. I think it is difficult because you cannot actually hear the patient's heartbeat directly. And it's not that you can make a diagnosis with just the test results only. So as a realistic issue, the first time visit online medical consultation is difficult, is how we look at it. But having said that, this time we are facing such a situation. So regarding the chronic diseases, a more active utilization of online medical consultation is something that the Ministry of Health, Labor and Welfare is promoting. By having the chronic disease patients be visiting the actual physical hospital, then being infected by the novel coronavirus is something we would like to avoid. Also, that is why we're promoting this online medical consultations. But how this online medical consultation itself is going to be promoted moving forward, the representative of the department in charge is not here, so I cannot share that view with you here today.
Hi, Fred Dvorak from the Wall Street Journal again. Given that there could be, from now on, an increase in the number of infected patients, and maybe quite a fast increase, are you planning some changes to testing methods, testing sites, and also quarantine sites or quarantine rules that could better accommodate a larger mass of patients and people who want to get tested or tested quickly?
First of all, regarding the testing method, Of course, moving forward, we do think that we need to further increase the capacity, testing capacity. Currently, we have the capacity of 9,000 tests per day. But we would like to continuously increase that. How the tests will be conducted. The patients that the doctors feel necessary to be tested will be subjected to the testing. The people who, but this testing does not have the nature of people who just want to be tested or does not have any symptoms. And even WHO is saying to test the people who have the symptoms. And we believe that we're aligned with WHO's way of thinking. And the quarantine method, I believe, was part of your question too. Regarding quarantine, on a necessary basis, we're increasing the number of countries that need to be quarantined. And I believe the other day, the United States, people coming from the United States of America, they need to stay at home for 14 days. We started requesting that. And we will be receiving opinions from the expert advisory committee and looking at the incoming number of patients and the Japan domestic number of patients, and we will be making the decisions.
So, for example, testing centers have been set up in the US or Korea that allow fast walk-through or fast, like a phone booth hoshiki or drive-through that are set up in remote places to allow for many more people to flow through quickly. As far as quarantine, if you have a large number of patients that are tested positive, even if they have mild symptoms, other countries have put them in a separate facility, not in a hospital, and in order to accommodate a large number of such patients. So are you planning any types of measures like that?
Regarding the sites that the tests can be conducted, the walkthrough, I don't know about the walkthrough testing, but the drive-through testing, based under our country's law, that is not impossible. Not impossible. So regarding the for the novel coronavirus patients who are suspicion of the new novel coronavirus and patients that does not have the suspension of that, there are hospitals that are completely separating those type of patients. And we are asked, there is surely an increase in number of hospitals that can conduct these tests. But if that's not enough, we may need to ask more medical institutions to conduct the tests. In Japan, we believe that there's quite a number of medical institutions that exist. And if that does not suffice, then we probably will need to establish a temporary testing sites. But at this point, establishing a temporary testing site as such is not in the plan. We do have a dedicated outpatient medical institutions for call center for Japanese returnees and potential contact patients. And we're trying to increase the number of medical institutions as such. And regarding quarantine, having people stay in places other than hospitals, this is something that was considered to be an item to be reviewed. And moving forward, in the case where we have a large increase in the number of patients in the medical institutions, we want them to surely look at the severe symptom patients. And so the mild symptoms patients, we probably will ask them to stay at home. But for those who are difficult to stay at home and take care of themselves, creating a site for those people to stay in, we believe that we are considering to establish such a site when necessary. But at this time, in order to establish such a site, what are the criterias? Or how can we prevent the infection spreading within the site? Or how can we provide a comfortable environment in the site? And we created a manual draft, and we are in consultation with the local government. And once that's decided, we'll be able to share that and disclose that to you. So taking care of themselves at home, at their own homes. You can think of that possibility too? Yes. And the points to be cautious about or to be careful of is also something that we are reviewing right now.
Obe from Aja Review. Just one point for clarification, if I may. So, with regard to expanding the number of medical institutions that can accommodate, I think you have to increase those numbers of hospitals because you never know what is going to happen going forward. That is my understanding. So, how far are you going to expand such number of hospitals? So, for example, I know that the public health centers and also designated medical institutions for infectious diseases are responding to this situation. But are you going to have second category hospitals accommodate, or even private clinics accommodate? So, to what extent do you need the hospitals? For example, you have to have separate entry points as well as exits, right, to accommodate for those patients. And the number of face masks involved will also be different. And also include N95 masks. How much equipment must you have to accommodate these patients? And also, of course, you have to go training for PPEs. That has to be done in an organizational manner. So expanding mechanisms to accommodate these patients, how specifically do you intend to address this situation? So with regard to outpatient and hospitalization, I think we have to separate these two because I think you have mixed these two into one. So let me separate between the outpatient care and hospitalization. With regard to outpatient care, I think through space or through distinction or time and space, you need to make a distinction between alternate patients and suspect cases. And that thinking is already displayed by the Ministry of Health, Labor and Welfare. So we need to have separation between the suspect cases and alternate patients. So separate entrance points, separate consultation rooms, or even if you use the same consultation room, you divide the time zone, for example, morning for one category and the afternoon for different category. So various local governments, based on the guidelines put forward by the ministry, is now making these designations. With regard to PPEs, for example, when you have to take samples from the throat, then you do not need N95 masks to take test samples from throats. So I think you need to take samples based on the guidelines that are provided forward. So we're talking about dedicated outpatients for a dedicated testing facility for outpatients. In the case of hospitalization, that's a separate category. So with regard to the designated medical institutions for infectious disease, that should be the primary medical institutions to accommodate these hospitalization. But as for the other categories, I understand that various local governments are having a hard time trying to explore other types of medical institutions. For example, when the novel influenza first outbroke, we had designated facilities to accommodate the novel influenza. So those designated medical facilities, and also medical facilities with robust countermeasures, be it large scale or medium scale. Various local governments would actually explore the possibility of having these hospitals to accommodate those patients. As far as the Ministry of Health, Labor and Welfare is concerned, we have carried out simulation for increased number of patients. unless you have concrete numbers on hand, the medical institutions cannot be motivated to respond to the situation. So we've shown those simulations, and also in terms of our thinking, we've shared that with various local governments, so that local governments can use this as a base to explore various medical institutions to accommodate potential patients going forward.
Questions? If not, I would like to close today's press conference. Thank you once again for gathering this evening.